Hello, everyone. Welcome to the Sleep Clinic. We have Catherine Stratta here. I'm really excited to learn more about bipolar and how we can help each other, whether we're neurodiverse or neurotypical, sleep more. Over to you, Catherine. Thank you very much.
Thank you very much, Yewande. Well, firstly, a very small bit about me. I've actually suffered from bipolar disorder since I was 12, but it wasn't until I was 25 that I was diagnosed. I'll be 61 this year, so I've had nearly 49 years of dealing with bipolar disorder. Bipolar disorder is a mood disorder. It affects 1 in 50 of the population in general, and that's worldwide. It's a very inclusive condition. It's not racial, gender, whatever. It affects everyone equally. And basically, it's a condition where people go from very high elevated mood to hypermania, and then further than that to mania, and then down to a very deep, dark depression. And people don't have control over those moods. And most people are medicated who are actually bipolar. The interesting thing about it is at the moment in the UK, the average time to diagnosis is 9.5 years, which is a very long time. And basically, it's because people don't go to the doctor when they're high. People only go when they're low. So what happens is that their doctors end up giving them antidepressants and sending them off. And antidepressants don't actually work very well on their own for people with bipolar. So what tends to happen is they kind of get better with other things on their own. And then they may have a high, another low, high, and then they'll go back to their doctors again when they have another low, not telling them about these other moods they're having. And so they'll get more antidepressants. So there's a kind of a cycle that goes on, because in this country, it has to be diagnosed by a psychiatrist. So the GP has to know to actually refer you. And that's one of the things that I help people to get help with, is actually knowing what to say to a GP to get a referral to a psychiatrist to then get a diagnosis of bipolar. And broadly, there are 3 types of bipolar. Bipolar 1, where people have mania, where they are in a psychotic state, and basically they don't have any idea what they're doing, and they can quite often end up hurting people or going out and doing things in the middle of the night, and being arrested because they're, doing things that they shouldn't be doing, legal things. And those people are bipolar 1. They also sometimes don't have depression, but most normally they do have depression as well. And then bipolar 2, which is where I fit in, there's a state of hypermania, which is very, very good mood. You're actually going along thinking that you can rule the world, you can do anything, you create things. I write poetry. You go around really thinking that you can do anything you want to, and the world is your oyster, which of course isn't. And very often people can end up spending money. So one tip for people is to, if they have relatives or friends that do this, please take their credit cards away, because otherwise you can get into very difficult financial circumstances with this kind of behavior. And then the low mood is the depression, which is actually for people with bipolar very dark, and very often with a lot of suicidal thoughts, because the depression for people with bipolar is terribly, terribly painful. It's like every single second is painful, and you start thinking that other people would be better off without you. It's not that you want to die, it's that you want the pain to stop, and you don't want other people to be kind of burdened with you. So it's a kind of quite a difficult thing to manage. Most people who are diagnosed do need to go on medication, and the condition tends not to get better. As you get older, it actually tends to get worse. And episodes do cause some damage to your brain. So it is, beneficial to get treatment as soon as you can. And one of the main problems for everyone with bipolar is sleep. There's 2 different sides. There's either not enough sleep, or some people, when they're depressed, sleep all the time and can't actually get out of bed to do anything. Myself, I have the not sleep type, so that when I'm depressed, I just don't sleep. I can't actually stop my brain moving, and I just lie there, and the time goes on, and I'm just exhausted every single day with the depression. But as I say, other people have the opposite problem. And one of the most interesting things I think about bipolar is that there's been some recent research about circadian rhythms. Now, all living things have circadian rhythms, which actually it's a 24-hour clock for us, approximately 24 hours. And that clock will tell your body what time to make different things, what time to switch on cortisol, what time to switch on different hormones. And one of the hormones that it tells you to switch on is melatonin. Now, melatonin is a hormone that helps you relax and get off to sleep. And if your body clock isn't working right, which is what happens with many people in bipolar, then the melatonin doesn't get started, that the release doesn't get started. And so you don't go into the normal way of sleeping at the right time for you. And this can actually precipitate an episode of either mania or depression if you're not getting into that sleep rhythm. There are a lot of things that you can do to help yourself. People have used bright light therapy. You have to be careful with that because it can in some ways lead to mania. But if it's controlled and you're using it with someone who knows what they're doing, a psychiatrist or someone, you can actually, by exposing yourself to different amounts of daylight during the day, get your rhythms back on track. And I think one of the most important things for people with bipolar is actually the time they wake up. I teach all my clients to wake up at the same time every day, which will fix the circadian rhythm. So, for instance, my waking time is 7 o'clock, and that happens every morning. So I avoid lie-ins at weekends, which is difficult. I struggle with that, as I think do a lot of people. But the point about it is that if you can keep your body and your mind in a rhythm that's stable, so getting up at the same time every day, that will kind of tether the going to sleep time, because you'll be tired at a certain time when you start having to get up at a particular time the next day. So that will be very helpful for you. If you can just, if there's, you're struggling with things, if you can just keep your waking time the same. There's a little bit of leeway allowed, sort of about 30 minutes either way, but it really does help if you can do that. And it's certainly done an awful lot to stabilize my mood, having that 7 o'clock waking time, even on the weekends. Other things you can do are you can actually use blue light blocking glasses. These are glasses with sort of orange lenses, and that will help block blue and green light, because blue light, again, stops the melatonin forming, so that your mind is, carrying on if you're not getting that gentle little push when the melatonin starts being discharged and starts just getting you off to a nice gentle sleep. So that's quite important. You can get blue blocking glasses on Amazon. You need to block out all of the light, so they need to be quite close fitting. And you ideally you shouldn't be using devices up to an hour before you go to bed. But if you have blue light blocking glasses, you can use them because it's stopping that blue light getting in. So that's a bit of a hack if you wanted to, be on your tablet or computer. The other thing is to turn your phone off or anything electronic off, so that you don't have that within 6 feet of you in your bedroom, because EMFs are given off from all of these electronic devices and they can interfere with your sleeping as well. So that's quite important. I always turn my phone off, and I have a different alarm clock. If you have an electronic alarm clock, that's fine. Just put it about 6 feet away from you. Other things that you can do, which will help enormously for bipolar disorder, are sleeping in the absolute darkness. So having blinds or curtains, and also blackout blinds, are very good, so that the body is getting the signal that it's absolutely dark, because the circadian rhythms go with dark and light. And they obviously change slightly as we go through the year, but your body does actually adapt to that. For bipolar, it's harder for you, but you will adapt if you keep the same time of the waking, like I said before. And other things that I personally find, having bipolar, that very often my mind gets quite overwhelmed and I get anxious about things that I remember, particularly just before I'm going to go to sleep. I think, oh, I didn't do this, or I forgot to do that. So I always keep a pad by my bed and I just write down whatever it is. And then that pad will stay there all night. So if I do wake up in the night and I'm thinking, oh, I must do this, then I write it down, which gets it out of your head onto the paper. And then you can think, I don't need to worry about that anymore. And that's quite a helpful thing to do, because you can then kind of clear your mind and hopefully just drift off back to sleep again. So also I do wear a blackout blind. I have a silk blind across my eyes that helps me, and I do also use earplugs because I'm a very light sleeper. And whilst I can get off to sleep using the blue blocker glasses and the darkness, I do often wake up during the night. And if I've got earplugs and the blind on, it helps me just block out any other extraneous sound, where, you know, a motorbike or something might have gone past that might have just wake me up before. But I use that, and that's quite helpful. And other things for simply for bipolar, it's very helpful for people to have a routine, that their body is ready to actually know when it's time to go to sleep. So really what I help my clients to do is work out the best routine for them, whether they want to do a little bit of stretching before they go to sleep, whether they want to read a normal book rather than a tablet is better. And also whether they want to actually do a sleep meditation, because very often it helps just to clear your mind before you go to bed. And what I do is I help people to work out what is the best routine for them, because we're all so different. Even, you know, having bipolar disorder, we are in a sort of broad label, but within that, people are so different and they have different things that they're willing to try. One of the other things that I do is I teach people to tap the meridians on the body, emotional freedom technique, which again, you can have scripts to help you fall asleep, because that will calm down the primitive part of your brain, the amygdala, and allow that center, which often sort of modulates fear and different emotions, just to calm down, so that again, you can clear your mind before you go to sleep, because that's quite important. Other things are having a warm shower before bed, just to, again, to get yourself just relaxed, and having the bedroom cold, because at night your body temperature drops, and it's meant to drop. I think it's 4:30 in the morning is the lowest point, but that again is determined by these circadian rhythms that tells your body when to do things and whatever. So that, as I say, if you can have helped your circadian rhythm to normalize by getting up at the same time, then these things tend to flow and your body does the right things at the right time. And then when the cortisol comes in early in the morning, that will wake you up. Some people use different clocks with lights and things. I personally haven't found that helpful, but again, some of my clients have. So it's really that there's quite a lot out there. There's a lot of research done into, you know, different ways that you can do different things. And I think it's very, very individual. So I work with people on a totally individual basis, to really find out what is best for them and what's going to really help them fall asleep, and of course, importantly, stay asleep, because there's nothing, you know, it's so frustrating when you're up and everyone else is asleep, and you know, you just cannot get to sleep. And my advice is, if you do find yourself up, actually get out of bed and go and do something else for a little bit until you feel sleepier, and then come back to bed. And really, you know, your bed is for sleeping. Other things that are good are essential oils. There are various books on different blends that you can use. Essential oils are so powerful because they use our sense of smell, and the olfactory nerve goes straight into the brain. So that actually can activate different areas in your brain. So if you can find different oils, say like lavender, which will help just calm you, you can even just have a little bottle and take the top off and just inhale it. And if you can inhale it with each nostril differently, that will go to both sides of your brain. So you hold one and then inhale for a bit until you can't smell it, and then open the other one and inhale for a bit again until you can't smell it. And at that point, it will have gone through to your brain and helped to calm everything down for you. So that's quite helpful. And again, different kinds of blends depending on what your sleep problems are. So there is a wealth of information that's out there, really, for sleep. Another thing that's quite important is diet, and actually not eating for 3 or 4 hours, because at night, what your body is trying to do is its housekeeping. And if it's got a lot to digest, then energy gets diverted and the housekeeping doesn't get done. And one of the most important parts of housekeeping is called autophagy, which is when your cells regenerate. And that's mediated by the mitochondria, which is a really important part of your metabolism. And if they're busy doing other things, then they can't do the autophagy. And one of the issues with dementia is that the autophagy doesn't get done, and then you get a lot of things that you shouldn't get, a lot of detritus and things, and the cells aren't renewed. So then you start getting plaques and all sorts of other things, and the brain cannot function properly the next day. And even, I mean, sleep is very delicate. Even with one night's missed sleep, your brain has a significant loss of function. So it's very, very important that you can actually let it do its job, do its housekeeping whilst you're asleep. So, and one of the other things that you can do to help that is to shorten the window of eating on the next day. If you can bring the window of eating down to about 10 or 11 hours, then that will mean that the body can just do its digestion when you're waken up. And then for the sleep, you'll have a longer time where your body can just do other things because it's not concentrating on that digestion. One of the other things, of course, is to look at vasovagal nerve stimulation. The vagus nerve goes to most of the organs in the body, and it is the arbiter of the parasympathetic system, which is basically rest and restoration. And that's the opposite of the sympathetic, which is fight or flight, that old saber-toothed tiger. And a lot of that happens in the amygdala. And as I mentioned before, with EFT, you can calm the amygdala down, and that will put you back into the rest and restoration, which is what you need to be doing at night, rather than thinking, oh my goodness, you know, what's happening. And you can also use different breathing techniques to help you sleep. A lot of clients use just a gentle diaphragmatic breathing at night, using a little bit of air hunger to actually help them get off to sleep. And one of the other interesting things is actually when you're looking at calming the body down, the old wives' tale of counting sheep does actually work, because what you're doing is you're taking your mind off not being able to sleep. If you're seeing a field or sheep or whatever else, a mental image you can use to do that, that is quite helpful. Because with sleeping, it's can be very sort of turned in on itself, because if you're worried about sleeping, then you get yourself into a state where your brain is thinking. And really what we want to be doing before sleep is to get back into our body. So out of our heads, into our body. And there's different Qigong exercises which you can do to help with that as well. And yoga will also help with that as well.
Okay, thank you very much, Catherine.
So,
that was very, very good. I'm really glad that you mentioned this, the smell part of it, because a lot of people I work with buy lavender spray off me and they spray it on their pillow and it helps them to sleep. I'm really glad you mentioned that, as well as other tips. So thank you very much. I'm going to stop the recording now, and then we'll have some questions from people actually here. Thank you.